Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
I want to welcome you to Heart of Health. I'm your host, Dr. James Marcum, and I'm just so glad you took the time to be with us today. We have an excellent topic, and on Heart of Health, you are the program. And you can be a part of our program today in several ways. You can call in with your questions. We answer them live. Our number is 423-800-0550. Or you can go to our website if you prefer to email. That's heartwiseministries.org. And we will answer your question live on air with a radiologist, Dr. Brent Barrow, who's agreed to join us today and answer your questions. You know, there's not too many programs out there that are willing to answer your questions live. Now, of course, we cannot give specific recommendations, but we can say in general, sort of give you a direction to go, might even give you some answers to questions that you might have that your doctor has brought up. So we want to invite you to call in. Our number is 423-800-0550. But I want to talk a little bit today about health across America. And one of the things we've done is we've reviewed all the newspapers across America. And we want to talk today a little bit about the stomach's dilemma. If I were a stomach and had my reading glasses on, I would be a little disturbed about what I read on the front page of the New York Times, dated March 27, 2012. And it states, surgery is found to aid diabetics. And 2 studies have recently found that weight loss surgery can reverse and possibly cure diabetes. And this is a major issue with 33% of the population obese and another 30% overweight. Well, it's no great surprise that this procedure costs between $15,000 and $30,000. And everyone's getting behind this as a great way to reverse and cure diabetes. Well, I want us to think, does this make sense at all? Here we're developing a procedure which has some risk in order to cure a disease that we could possibly change in other ways. So I want us to think about, these bariatric surgeries and gastric bypass. They might be paid by insurance carriers, but wouldn't it be great if we took this money that was used for gastric and educated people, maybe pay for a gym membership or counseling by a nutrition, or hire some people to really work with the person one-on-one. Therefore, we might help them lose weight naturally, get rid of their type 2 diabetes, and they don't have to have a procedure that may or may not work, that may or may not have long-term benefits. Well, this is something I want you to think about. Well, if you want to give us a call at 423-800-0550, we're going to have radiologist Dr. Brent Barrow join us after this short break. You're watching Heart of Health, where you are the program. Please stay with us. Give us a call or go to our website, heartwiseministries.org. We're going to be right back after this short break.
The Heart of Health Live will be right back.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
Three children are suffering from fatal heart defects.
They're on borrowed time.
Those children have to go overseas.
There is hope,
The Children's Heart Project is so touching.
It's our passion to help these children.
but not without risk.
Any kind of open heart surgery is going to be risky.
Without the surgery, the children would die.
Don't miss this unforgettable television event, Children's Heart. Check your local listings for dates and times or go to childrensheart.tv.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health. I'm Dr. James Marcum, your host. And if you have a question for our guest today, radiologist Dr. Brent Barrow, give us a call at 423-800-0550. Dr. Barrow, thank you for joining us today.
Thanks, Jim, for asking me.
And for our viewers that might not be familiar with a radiologist or even can't decide whether they even have a question about radiology, tell us about what a radiologist is, how you got interested in it, and what's this all about?
Well, a radiologist is a specialty in medicine that we all kind of go through that 4-year medical school, and
Right.
then in that medical school we kind of decide what we're going to go into. I was exposed during a rotation as a medical student to a radiology practice, particularly as a particular individual in that practice that did interventional radiology with a lot of procedures and catheter-based things and whatever that I just found very, very intriguing, and kind of chose, because of that relationship and that exposure, chose it as knowing that I was going to do interventional radiology even after I completed my radiology residency, do that as a fellowship, and subsequently was able to go to Atlanta and get trained, and then out into practice.
Well, you've been practicing for a few years now, haven't you?
I have.
Okay. You got a few years.
I got a few years. I got a few years on me.
You don't have to tell how many you have. But a lot of people don't realize that radiology in the 21st century is a lot more than just looking at X-rays.
Absolutely. I mean, we do interpret the X-rays. You have a whole staff of X-ray technologists that take the X-rays for the patient. Many times, because of that, the patient doesn't have any sort of a relationship with the radiologist, any contact at all. But beyond the X-rays, of course, we interpret ultrasound studies, CT scans or CAT scans.
Now, ultrasound is sound wave, right?
Ultrasound is sound waves.
Okay.
A CT scan is another X-ray sort of a study that's different technology. Nuclear medicine, including PET imaging, MRI, which is not any radiation at all, but a strong magnetic field, and then the whole kind of gambit of the interventional radiology procedures.
And all of these are different ways to look inside the body.
Inside the body.
Wow.
Yeah.
Wow. Now, a lot of this technology how did radiologists even function before we had all this?
Well, it was
when did the profession start, I guess?
Well, it's been around a long, long time.
Okay.
Madame Curie and Röntgen and all these
Okay.
people from a long, long time ago. Back in the day prior to CT scan, particularly, and then MRI and even ultrasound, there was kind of the joke that radiologists were shadow doctors, because that's kind of all you looked at.
Right.
You had X-rays, and you could put contrast into the GI tract or into the kidney urinary system, but you were very limited in how you could actually image inside the body. You're trying to discern what was going on. Now, we can not only see down to the millimeter, structures in the body, but we can even make 3D representations of that.
Wow.
And it's really exciting. I mean, it's really a lot of fun.
So a radiologist's function is to look inside the body and to look at things and see if there might be problems with it or
Sure.
things are malfunctioning.
We're kind of that, anatomist of sorts, knowing what the anatomy is supposed to look like, and then the kind of a pathophysiologist understanding kind of how we can manipulate our imaging studies to discern certain things or answer certain questions. And then also from the pathology standpoint, what those pathologic things look like, be it a solid tumor or inflammation or a kidney stone or whatever.
Okay, so you actually have the ability to go in also and pull out a little piece of tissue where we can look at it and
Absolutely.
see if it's normal or abnormal.
Biopsying can be done now through multiple different modalities, everything from, you know, ultrasound, CT, even MR compatible, you know, biopsies are now being done.
And then I think our viewers are going to be interested. Not only can you help make a diagnosis and find something's wrong, but now you guys can deliver treatment.
Absolutely. We can treat things based upon in blood vessels. We can open up blood vessels. If there are clots in veins or arteries, we can remove those. We can put filters in veins to stop clots. But we can also then deliver chemotherapy agents into organs that may have tumors. Lots of different aspects of it.
Well, I'm sure our viewers are going to have lots of questions. And if you have questions, we want to invite you now to pick up the phone, 423-800-0550. Or if you want to go to our website, that's heartwiseministry.org. Dr. Barrow's here ready to answer your question. Of course, we can't substitute for your own doctor, but we can give general guidelines and help guide you along the path. So we want to invite you to call in, Dr. Barrows. And I think this is going to be very interesting. I'm not only so much answering people's questions and helping them out, but also helping everyone learn more about what a radiologist does. I mean, some of us just think you look at boxes. And you know, one of the things we want to emphasize is there's a great place for modern medicine. It doesn't fix everything. There's a great place for lifestyle, and that helps us not need modern medicine. But we also on Heart of Health talk about that relationship with the great physician who helps us other physicians do better. So I want you to stay with us after this break. Give us a call, 423-800-0550, or go to our website, heartwiseministries.org. We're going to be right back with Dr. Brent Barrow, so don't go away. Pick up the phone, give us a call.
The Heart of Health Live will be right back.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance. When to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
Three children are suffering from fatal heart defects.
They're on borrowed time.
Those children have to go overseas.
There is hope,
The Children's Heart Project is so touching.
It's our passion to help these children.
but not without risk.
Any kind of open heart surgery is going to be risky.
Without the surgery, the children would die.
Don't miss this unforgettable television event, Children's Heart. Check your local listings for dates and times or go to childrensheart.tv.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. I'm your host, Dr. James Marcum. Thank you for joining us today. And we're with Dr. Brent Barrow from Vista Radiology. He's a radiologist, and we learned last segment that you guys do a lot of things besides looking at x-ray pictures.
We do.
You know, our first question comes from the internet. That's heartwidesministries.org. And this person asked, you know, I recently had a stent placed in one of my blood vessels. I really wasn't sure exactly what that was. Could you help me learn more about this?
Great.
So they want to, let's talk a little bit about what things that you put in to help people out. Why would you put a stent graft in?
Well, stents in a generic sense are a device that has been made that we can put inside of a blood vessel, be it a coronary or a peripheral vessel, that helps stent or reopen that blood vessel.
Okay. So blood can go through?
Blood can go through and improve the blood flow from proximal to distal, or from above or to below. These tend, if you think about a lesion inside that artery as say a kink in a hose, and then you could go inside that hose and open something back up. And I've got some examples. You know, what we characteristically used to put in people was a metal stent. And this is an example of it's very pliable. It's a self-expanding metal stent that we would put inside of an artery. This is probably 5 to 7 millimeters in diameter. This would typically go in. It goes in on a catheter.
Okay.
So we usually, if it's say it's a leg or a pelvic blood vessel, we'll access from the groin, put a catheter in. We then can deploy this stent across the segment that we need to, usually with a balloon catheter to angioplasty afterwards, and open that stent up so it looks very similar to this. And this is a self-expanding stent that's fairly flexible, so it can contour to that anatomy fairly easily.
Now, what's that made of?
This is made of it's a nitinol kind of material, which is a titanium alloy that is very flexible. We do have, this is a real small version and probably not very well seen, but this is actually, this is very rigid. This is a small, very rigid stent that we would maybe put inside of a renal artery.
Okay.
But this is usually goes on a balloon catheter. We call this a balloon expandable stent. Very rigid, not nearly as flexible as that. Then we get to things like that, or this. This is actually a stent graft, a short little segment of one. But this, on the outside, there's actually stent material.
Right.
And it, of course, when it goes in very collapsed down, and then it expands. Right. But on the inside, where the blood flows through it, it's actually graft material.
Okay.
Very similar to graft material that a surgeon would have placed if he was going to do a bypass graft of something. This would be, in a longer version, could be something that we would place down the length of the artery in the leg.
Okay.
We have similar kinds of device, like this device, which is, it looks kind of like a
looks like a blood vessel.
It looks like well, it is. This is actually to put in somebody's aorta.
Okay.
Somebody that has a abdominal aortic aneurysm, where the aorta has kind of become saccular or expands out, and the abdominal wall gets weak. As it gets bigger, the risk of rupture goes up. Okay. So we can actually, again, without having surgery, other than maybe a small incision in the groin, this is all, it's amazing how these things go in. They go in a little catheter, all collapse down, and then when we deploy this, it goes in the abdominal aorta. There's one limb that goes one side, another piece like this but longer would fit through here and go on the other side, and we literally recreate that abdominal aorta from the inside, allowing blood flow to flow through the lumen, excluding that aneurysm.
So these are all grafts that help the artery open up if they have blockages in them?
Yep.
And if they have a weak spot like an aneurysm that helps them not rupture?
We can exclude that from rupturing and prevent it from rupturing.
What did people, now do you have to be cut open for this? I mean, is it a big surgery?
Well, for stent grafts, most of the time it's a small little incision in the groin.
Wow.
For the smaller stents, most of the time it's just a puncture wound. It literally is just a puncture, and when the patient leaves the lab, we've even put a closure device into that artery wall, and they have a Band-Aid, and that's it.
And before this technology, people would either have to be cut open and repaired surgically,
absolutely,
or they would have to not even be repaired and have something bad happen.
Absolutely.
So you can put these stents and blood vessels in the aorta, in the neck.
Neck, some.
Kidney, some.
Absolutely.
Legs.
Absolutely.
All over. Wow.
All over.
So if you might be out there and want to learn more about this, you know, one thing I always like to know if a person's having a symptom, you know, pain in the legs, person might need it.
That's one of your claudication symptoms in the legs. Yeah. You walk a short distance, you're okay. You walk a longer distance and your legs start to ache, and then you rest and they get better. Wow. You have claudication, you may be somebody who has some underlying kinks in that hose.
Well, I think that answered our question from our website. Good. That's heartwiseministries.org. And after the break, we're going to come back. If you might want to get a hold of us, give us a call, 423-800-0550. We have live with us tonight Dr. Brent Barrow. If you have a question, just stick by, stay with us. We'll be right back after this break.
The Heart of Health Live will be right back.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
Three children are suffering from fatal heart defects.
They're on borrowed time.
Those children have to go overseas.
There is hope,
The Children's Heart Project is so touching.
It's our passion to help these children.
but not without risk.
Any kind of open heart surgery is going to be risky.
Without the surgery, the children would die.
Don't miss this unforgettable television event, Children's Heart. Check your local listings for dates and times or go to childrensheart.tv.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health, and we're here with Dr. Brent Barrow, radiologist, answering your questions live. And we have a question from Lori in San Francisco, Dr. Barrow. Lori, you're on with us on Heart of Health. Can you just shoot us your question? Okay, I think we're having a few technical difficulties with Lori. But Lori, can you hear me out there? Okay, Brent. Well, you know, we're going to get Lori on shortly from San Francisco. But, you know, we were talking in our last segment about the stent grafts and all the different things it can do, how you can deploy those. Just very, very fascinating. Now, you know, you showed me a little bit of cement that you had.
Oh, yeah, I do have.
Off the break. And what would a radiologist use this cement for?
This is just a little example of a piece of leftover cement that we used. There's a couple procedures called either a kyphoplasty or sacroplasty, where a patient may have either a fracture in a vertebral body or in the sacroplasty in the sacrum itself. If the patient has the right anatomy and the right findings, we can actually potentially treat that fracture percutaneously, meaning through the skin, not
Right.
surgically, and place some cement into the vertebral body or into that sacrum to fix the fracture from the inside.
Right.
Keeping it from moving, which is, in most cases, the cause of pain for the patient, is not that they've had the fracture, but that the fracture continues to have motion.
Right. So this might be a very good thing to do for someone that had a vertebral fracture that was having a lot of pain.
Absolutely. Somebody, particularly as patients get older, they become more osteoporotic, they lose bone mass or bone density, they're susceptible to compression fractures, and those patients may be a candidate for something like a vertebroplasty.
Now how long would this take to perform?
The kyphoplasties that we do, a one level, the technical part or my part of the procedure is probably 15 to 20 minutes. Patients can be done either, some of them are done based upon the anesthesia's evaluation. They may be intubated, they may have to be put to sleep.
Right.
But a lot of them are just done with heavy IV sedation. So they're not even put to sleep. And then when they get up, actually the one we did just the other day, patient walked in a room an hour after the procedure. She's sitting up at the side of the eating lunch for the afternoon and says she's feeling tremendously better.
Wow, that's amazing technology. I think we got Lori back on from San Francisco. So
Great.
Lori, you're on with us with Dr. Brent Barrow. What's your questions today?
Yes, hi.
Hi, Lori.
I have a question. What is the difference between an MRI and a CT scan?
Great question. The in the very basics of it, they both look very similar.
Right.
They look like a tube of varying lengths with a hole in the middle of it, kind of a donut.
Okay.
But they are actually very different in what we do. A CT scan, computed tomography scan, is actually an X-ray generating scan that uses X-rays, exposes the patient to some level of radiation while we're imaging whatever portion of the body that we are. MRI is a magnetic resonance imaging. We're actually using a powerful magnet, sometimes upwards of 10 or 20,000 times the Earth's gravitational field. We use that magnet and then literally a series of radio frequency pulses and receivers to excite the free water molecules in your body to be able to then image the soft tissue and the tissues inside the body without having to look inside there, getting very exquisite detail potentially of those soft tissues, nerves, bone, or not bone as much, but tendon and muscle, without any exposure to radiation.
Yeah, Lori, are you still with us out there?
Yes, I am.
Have you ever had an MRI on your body?
No, I have not.
Okay. It sounds like MRI is a lot better as far as radiation goes.
Well, there is no radiation with MRI. It has, like everything that we have on our plate or palette, so to speak, as a radiologist, all of them have pluses and minuses depending upon what we're looking for.
Right.
MRI is exquisite for particularly looking at the brain.
Okay.
Looking at the spinal cord and looking at the spine. Areas that have motion are more difficult to image. We're getting faster and better techniques to look at the heart.
Right.
And even in the abdomen, you would think, well, there's not a lot of motion in the abdomen, but of course, when patients breathe, everything in the abdomen moves a little bit.
Wow.
The peristalsis of the GI tract. But we're perfecting ways of even doing a lot more imaging, and I think as the radiation precautions are heightened and people become more concerned about that, some of which is I think reasonable and legitimate. Some of it may be overcautious, but we'll be using MRI for a lot more imaging that we currently use CT for.
Wow. Lori,
it's also a lot longer.
Lori, I hope that answers your question. Hope you don't ever have to have a PET scan or any of those scans, but if you do, I mean, it sounds like we have some ways to look in and find out what the problem is.
It's worth having if you need to have it.
Okay. Well,
thank you so much.
Thank you for
Lori.
calling, Lori. It's about time for us to go to break, but if you want your questions answered, give us a call, 423-800-0550. We will be right back with Dr. Brent Barrow answering your questions after this break.
The Heart of Health Live will be right back.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
Three children are suffering from fatal heart defects.
They're on borrowed time.
Those children have to go overseas.
There is hope,
The Children's Heart Project is so touching.
It's our passion to help these children.
but not without risk.
Any kind of open heart surgery is going to be risky.
Without the surgery, the children would die.
Don't miss this unforgettable television event, Children's Heart. Check your local listings for dates and times or go to childrensheart.tv.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health. We're glad you took time to join us today. Hopefully you're learning something about radiology. We're answering your questions live here tonight. And I think we have another caller, Dr. Barrow. And this caller is Jillian, and she's calling from North Carolina. Jillian, can you hear us?
Yes, I can.
Okay, what's your question tonight for Dr. Barrow?
All right. The other day, I was at the doctor's office, and it was an extremely stressful situation. And I forgot to ask this question, but I had gone to the doctor because I had some fluid in my lungs. And he told me I needed to go see a radiologist for treatment. And in my experience with radiologists, I thought that they just sat in a room and looked at screens and read pictures and things, and I couldn't figure out, once I got home, I couldn't figure out why my doctor would send me to a radiologist for fluid in my lungs.
Dr. Barrow.
Well, Jillian, that is a great question, and and you're in part right. There are myself as an interventional radiologist, we do some of those procedures that there are some in radiology that don't. I mean, it's kind of the same way even in cardiology. You have interventional cardiologists and non-interventional cardiologists. But there are a group of within our specialty that we do procedures. And one of the things that your doctor is probably recommending is that you have what's called a thoracentesis. She probably had a chest x-ray that has shown that she has some fluid of some degree in the chest. Normally with that, what we'll do is you would, in my facility, you would come in as an outpatient. It is an outpatient procedure. Once we make sure that your labs are okay and a few basic lab tests, usually it's done with you sitting up. Normally we'll do this from behind, use an ultrasound probe to first localize the fluid to make sure you actually have enough to even drain. If that's adequate and everything's fine as far as lab work, sterilely clean the skin, sterile drapes, numbing medicine in the chest wall to kind of numb things up, and then we'll put a little catheter into the chest, into the pleural space, which is that space in between the chest wall and the lung, where the fluid accumulates, and drain that fluid off. Either can do it as a diagnostic procedure, and that time many times we just put a little needle in the chest just to drain enough off so we can get a sample, send it to the lab, to find out why she has the pleural fluid collection. Or we could do a therapeutic thoracentesis, which is where we're actually going in to try to remove most of it to allow the lung to re-expand and to hopefully the body can then resolve the rest of it on its own.
Now, Jillian, has your doctor told you what he expects might be going on, what he's looking for?
Not really.
Okay.
Some
But,
patients...
You know, I heard Dr. Barrow say a catheter. Is that the same thing as a needle?
Well, great question. It's a little plastic tube that rides on top of a needle. So once we prepare the skin and get the chest wall numbed up, we place this little catheter and needle through the skin, but then kind of like the IV that you have in your arm for sometimes, it's a little, all that's left in the chest is a little plastic catheter, not the metal needle. So it's much softer, it doesn't damage the lung, or couldn't damage the lung nearly as much as, say, just a sharp metal object. Jillian may have had a pneumonia. That she maybe didn't know about and had some pleurisy or something like that related to that. There are a number of other medical conditions that potentially could cause pleural fluid to collect. And if she has enough and she's symptomatic, she probably needs to get that looked at just so they can kind of figure out more specifically what's going on. Now,
does this hurt very much, this procedure?
Yeah, the patients that I deal with, the worst thing is the numbing medicine. It's always, it just burns and stings a little bit. You give it slow and let it take effect. And most of the time, patients don't know that the procedure's over when we're done.
Jillian, does that answer your question?
It does, but I have one follow-up question.
Yeah.
Okay.
If you have this procedure done one time, does that take care of it, or might you have to have it again?
That's a great question, Jillian. That really is. That's a great question. In most cases, yes.
Okay.
There are some medical conditions where patients will have a reaccumulation of fluid over time that may have subsequent. But the vast majority of patients, particularly someone who's otherwise healthy, the fluid will get resolved probably after one treatment, and she would never need anything again.
Wow, well that's great. Well, Jillian, I hope that answered your question here. And call us again. If you have more questions, you can always go to our website. That's heartwiseministries.org. I just found that very interesting, Brent.
Thanks for the call, Jillian. That was great.
That you can go in there and take the fluid out, and that's why they might send you, because you have greater expertise in localizing and finding that fluid.
Yeah.
Do you do this very often, or is it something
almost
that you do?
every day?
And I guess if you could take a fluid out from this area, you can take fluid or from just about anywhere.
Abdomen, and yes, absolutely.
Well, that's very exciting here. I want to tell our viewers we still have some more time. If you might have some questions, you can give us a call, 423-800-0550, or you can go to our website, heartwiseministries.org. We're just very happy to have your questions today. And Brent, I want to thank you for being with us, talk to everyone about radiology, what it does, all the interesting things. A lot of people have questions about medicine and they don't know where to get the answers to. And sometimes when they can talk to someone or do something from a website, it makes it very much more interesting.
The Heart of Health Live will be right back.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
I'm Dr. James Marcum, and I want to welcome you back to Heart of Health. We've been answering some great questions, Dr. Barrow. They're coming from all over, and I think we got another question on the line, and I think it's Dana. Dana, is that you on the line calling? I don't know. We're going to have to hook Dana up in a second, Dr. Barrow.
That's okay.
And we're going to, we want to answer as many questions as we can, and there's many different ways. They can go to our website, heartwiseministries.org. They can also call us, and our number is 423-800-04550. Or now, have you heard about Facebook, Dr. Barrow?
Oh, yeah.
Now, I think they got Dana on the air. Dana, you're on with Dr. Brent Barrow. Go ahead with your question.
Hi, Dana.
Okay, she's being a little bit shy tonight. I hope that question comes through. Okay, well, listen, while we're waiting for Dana to come through, we had a question that came in our Facebook page.
Okay.
And this has to do with mammography. And this says, I had a mammogram done and had a negative result on the mammogram, but this patient still has a lump. She's 65 years old with a family history of breast cancer. She says, I know you cannot give specific, but is going to a surgeon a good idea? So let's talk about mammography a little bit.
Okay. Well, in general, a mammogram is kind of our go-to screening test for breast imaging. And, you know, there's been a lot of controversy out there as far as guidelines and when to have it and whatever, but I think most people believe after the age of 40, you probably need to start having it every other year.
Right.
After 50, every year.
Okay.
And the reason for that is what we're looking for is we're trying to find that breast cancer in as early a stage as possible.
Okay.
Somebody who has a breast cancer family history,
okay,
and that's usually primary relatives, sisters, mothers, you know, primary relatives.
And this lady did.
And this lady does.
Okay.
And she has a palpable abnormality. She would actually not go in for a screening mammogram. She would actually go in for a diagnostic mammogram.
Okay.
And in that, she's going to get the routine 4 views that we normally do for a screening study, plus any additional views that we may need to try to answer the question. It sounds like in her case that she had her mammogram with a known history of a palpable area, and the mammogram was negative.
Right.
Well, in her case, we're not done.
Okay.
We're not done with the workup. She probably needs to get an ultrasound of that area or of the whole breast, depending upon what is the...
Because she still feels something.
She still feels something.
Right. Okay.
And the reason why we need to press on to answer the question is because she does feel something.
Right.
Going to a surgeon, I think, is a great idea because they're going to be able to, whether they do the ultrasound in the office or they send them back to the imaging area where she got her mammogram to do the ultrasound, she may need, if there is something that shows up on the ultrasound, she may need a surgical follow-up.
Right.
She could get the ultrasound prior to going to the surgeon, and then when she goes there, she can get all of the questions answered. I have a palpable lump, the mammogram's negative, I have a cyst in the breast, what do we need to do? Since it's palpable, it hurts, it's symptomatic, can I drain the cyst? Done.
Okay.
Or negative mammogram, have a solid nodule in the breast. It looks benign, but we probably need to maybe follow it, or maybe we need to do a stereotactic biopsy.
Right.
And the surgeon would be the right person to direct her in that regard.
So this now, if let's say a person would come to you in need of a mammogram,
okay,
and let's say they would just come on their own,
and that is now becoming more apparent with what they call self-referred mammograms.
Right. Now, if you sent them a letter and stated, your mammogram was negative, would you didn't actually see the patient and examine them,
right,
but what if they still had some concerns or felt a lump or something? How would you sort of move them to the next step in healthcare?
Okay. Well, when a patient comes in for a mammogram, let's say it's a screening study, because usually if it's a diagnostic study, if somebody has something palpable, they're typically already, we want to connect them with the physician before they even show up.
Right.
But as a screening patient, they show up for a self-referred mammogram. They're going to give us their basic history. Okay. They're also going to give us hopefully a name of a contact physician that they've used in the past. And when we read the mammogram, I'm going to send a report of her mammogram report to her doctor.
Okay.
She will get a layperson letter, or we call it a lay letter,
okay,
mailed to the address that she gives us that says your mammogram is fine. If it was the first time we've ever seen her, it's a baseline study, and we'll tell her what she may need in follow-up as far as yearly mammograms. If it's some patient that we've seen every year, she'll have gotten those letters every year.
Yeah. Okay. Well, it sounds like we're going to have to go to break. After this short break, we'll be back and we'll continue this discussion on mammography. We'll be right back. Stay with us on Heart of Health.
The Heart of Health Live will be right back.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Dr. James Marcum with Dr. Brent Barrow. We're talking about radiology today. And if you have a question, 423-800-0550 or a website, that's heartwiseministries.org. Dr. Barrow, we're finishing up mammography, and we talked about a lady that had a question on our website, and I think she should go see a surgeon. What's the role of PET scanning? And let's sort of finish up this topic. What's some things you'd like to share with our audience?
Well, in breast imaging, there's a lot of stuff out there. Mammography is our screening tool. Mm-hmm. We use ultrasound to augment mammography.
Right.
There is a very definite place in the workup, particularly if we have positive tissue biopsy for breast cancer,
right,
for MRI. Not every patient needs it, but there are several categories of patients that do need MRI. PET imaging is something that people have talked about and it's helpful. PET is it's physiologic imaging. Mm-hmm. There's also some new gamma imaging, non-PET nuclear medicine imaging that is specific to breast that is coming out. Even within mammography, there's even the new specialty or a new type called tomosynthesis. So instead of just taking a single view, it takes a whole series of views at one time, with greater definition of the tissue, greater differentiation of normal from abnormal. A lot of things that are happening in breast. I think in the next several years we'll have a lot new advances.
Yeah, now we hear about these, you can look for mutations now. I think we're going to have a lot more being said, and I think this is a topic we're going to continue to discuss. So I guess to answer that question that came to our website, she should go see her surgeon, get more information.
I think she needs to see an ultrasound, and she needs to see somebody who can potentially help her.
Okay. Well, I think we have a question coming from Arvid, and Arvid's calling us from South Dakota. Arvid, are you on the line with us?
Yes, I am.
What's your question for Dr. Barrow, Arvid?
Okay, well, first of all, I appreciate listening to health programs like this one so I can learn so much. I have one question for you today. How do you handle a small, non-calcified pulmonary nodule in a non-smoker?
Arvid, do you have a nodule? Is that why you're asking? I'm just kidding. Brent, how'd you handle that?
Well, you know, he says it's a very simple question.
Yeah.
It's not a very simple question.
Okay. Well, let's help him out.
But let's help him out.
Yeah.
There's kind of two schools of thought with pulmonary nodules. There are some people who treat things very aggressively, and I think there is a very well-established protocol, kind of a scheme that has been devised by chest specialists to deal with pulmonary nodules, and it's based upon two major criteria. One is lesion size, and the other one is their risk factors. The biggest single risk factor is smoking.
Right. And
so in a patient who is a non-smoker with a small pulmonary nodule, let's say less than 4 millimeters, non-calcified, because calcified nodules we're really not worried about because that's probably just a granuloma.
Right, exactly.
And they can be small, punctate 1 to 2 millimeters. They can be greater than a centimeter. It's very variable. But those small, non-calcified in a non-smoker is of very low likelihood of malignant potential. They may follow up in a year's period of time. But if it's a 7 millimeter nodule in a non-smoker, we're probably going to follow them up in 6 months.
And when you say follow-up, what type of test?
It's probably going to be a CAT scan, a CT scan. There's some data and research that's being done right now on using screening CT. We use screening mammography to screen all women potentially for breast cancer. We don't do that for all patients who have lungs because that would be way too much exposure to the general population, but patients who are at high risk, smoking history, asbestos history, coal miners, certain subpopulations of the community, there is some promising research to show that screening them with CT finds cancers earlier. Of course, anytime we can find a cancer smaller is better. And so that's why we're using some of these. But in a non-calcified nodule, small, probably very unlikely to be a malignancy, needs to be followed, but conservatively. I would not rush into biopsying a very small nodule.
So let's say Arvid goes along and they repeat it, and it stays the same. Nothing changed.
Great news. Great news. Then
does it still need to be followed every so often?
Well, probably then we can probably almost double the interval. We may go from a year to 2 years.
To keep an eye on it.
But if it gets bigger, then we get a little bit. That doesn't in and of itself mean it's malignant, because granulomas can change some over time too. But we are going to want to watch it more closely.
So the big thing is if it's calcified, we don't worry too much about those.
Not at all.
And if it's small and there's not very many risk, we don't worry about it. But let's play devil's advocate. Let's say we have a smoker with a nodule that starts, you take it and you're not really sure, you repeat the scan and now it gets bigger.
That's a bad sign. That's a sign that that patient may need to have some more aggressive treatment, potentially if it's close to a centimeter in size, a PET CT scan. If it's larger than a centimeter, potentially even biopsy.
Well, we're going to go to break, Dr. Barrow. We're going to continue this right after break. Stay with us. Don't go away.
The Heart of Health Live will be right back.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
Three children are suffering from fatal heart defects.
They're on borrowed time.
Those children have to go overseas.
There is hope,
The Children's Heart Project is so touching.
It's our passion to help these children.
but not without risk.
Any kind of open heart surgery is going to be risky.
Without the surgery, the children would die.
Don't miss this unforgettable television event, Children's Heart. Check your local listings for dates and times or go to childrensheart.tv.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health. I'm Dr. James Marcum with Dr. Brent Barrow. We've been answering your questions today about radiology, and unfortunately, there's lots of questions. We can't get to them all. So Dr. Barrow, if there's one parting comment that you'd like to leave for all of our audiences, what would you like to tell them about your field, radiology?
Patients need to take responsibility for their health care.
Right?
When it comes to imaging studies, if you've had an imaging study somewhere else other than where you're going, bring your images with you.
Okay. Take your pictures with you.
That helps us, the imager, the interpreter, get a better idea of what's going on to be able to compare old with new to determine what's changed and what hasn't.
Okay. And you know what I've learned today is that radiologists do so much more than look at pictures in a room. We want to thank you for joining us today on Heart of Health. Stay with us next time, and we love to answer your questions. Go to our website, give us a call. Thanks for joining us today on Heart of Health.